Good afternoon, everybody, and thanks so much for joining us here on KXAN Live. I'm Will DuPree, coming to you from the KXAN Live studio. We hope you're enjoying your Wednesday afternoon, but we wanted to hop on here for a conversation about monkeypox. A lot of you have questions about it. What exactly is it? What are the symptoms involved? How seriously we should take this situation now that there are a confirmed number of increasing cases here in the state. Let's give you a glimpse about what the situation is here in Texas at the moment. The CDC currently reporting at least 20 cases of monkeypox in Texas. That number went up by 8 overnight after presumably tests came back. Now, in Travis County, we do know there is one case confirmed at this time. However, Austin Public Health shared yesterday that at least 5 other people may have it too because they're showing possible symptoms. Right now on KXAN.com, I want to point you to this interactive article that we have from our data reporter, Christopher Adams. He's helping us keep track of where monkeypox cases are confirmed throughout the state. There's even a map that you can see right here that breaks down which areas are seeing those cases. Now, to give you a sense about what exactly monkeypox is, the symptoms, and how much of a risk it is currently in our state, we're lucky to have a guest joining us here today to share some perspective about that and also some advice. So let's welcome into our conversation now Dr. Jennifer Schufert. She is the Chief State Epidemiologist for the Texas Department of State Health Services. Dr. Schufert, thank you for being here.
Thanks for having me.
We really appreciate you taking the time to do this. We mentioned there that the CDC confirmed at least 20 cases of monkeypox in Texas. So that begs the question, how seriously should we take what is happening here in the monkeypox situation in the state?
So I can tell you that from the public health perspective, we're taking this very seriously. We're trying to do everything that we can to identify people who might have monkeypox and to make sure that they get the care that they need and that people that they may have contacted will get the care that they need as well. And so we're doing everything that we can to make sure those people are taken care of. But I can tell you that right now, we've got those 20 cases that you talked about in our state. And so we still don't have a lot of people in our state who have this. And so while we're concerned and we're trying to do everything that we can to take care of those people, we're not seeing this spread like we did COVID, where just being in the same air, in the same room with infected people could get you infected, or seeing spread before symptoms started. We saw spread like that during COVID, and monkeypox just isn't the same. And so while we're really concerned about it, I don't want people to think that the spread that we're seeing with monkeypox is equivalent to the spread that we were seeing and are seeing with COVID-19.
Let's just go back to the base of this. What exactly is monkeypox?
Sure. So monkeypox is a disease that's caused by a virus. It's caused by an orthopox virus, and that family of viruses includes smallpox. And so it is a virus, the monkeypox virus, that was identified decades ago in Africa, and it's endemic there. And so they have cases there that stay in their animal population and can spill over into the human population. And so that's where most of the world's cases usually happen. What we're seeing now is different. We are seeing an outbreak of monkeypox happen outside of Africa, outside of those endemic areas. And so this is new for public health around the world to try to be controlling this in other places.
How is monkeypox spread? Because I think a lot of people are used to what the advice is and the general medical information about COVID. That's obviously been top of mind for so many people, but let's just go back to monkeypox and explain how it's spread right now.
Sure. So typically what we had seen previously, especially in the African countries where this was endemic, is that it was through animal contact a lot of times. But that's not what we're seeing here. What we're seeing with the current outbreak that's happening around the world is that it's being driven by mostly skin-to-skin contact. We know that there's a small possibility that it can be spread through droplets, so little bits of respiratory secretions that come out of your mouth when you talk or sneeze or cough. But most of what's driving the current outbreak is close skin-to-skin contact. And so anytime that somebody has those monkeypox lesions on their skin, they can spread it to somebody else through that really close skin-to-skin contact.
Given that close contact is really the way that this is spread, or at least seemingly right now from the experts, are you all sharing from the Texas Department of State Health Services advice to air travel companies or businesses like hotels?
So we are pushing out our message broadly about the risks of the disease and what we're looking for, but also understanding that this isn't as widespread or transmitting quite as easily as some other diseases that we're used to. And so this is one where that close skin-to-skin contact can cause transmission. But interestingly, in the cases that we've had in the United States, and right now CDC is saying it's about 559 cases across the United States, we're not seeing any spread on airplanes so far. We're not seeing any spread from patients to healthcare providers. And most of those healthcare providers are really good about putting on that protective equipment. But with those precautions in place, we're just not seeing spread in those other settings right now. It's mostly with just that skin-to-skin contact between two people.
Yeah, thank you for clarifying that too. I've just seen that conversation point come up a lot in social media and other conversations that I've been having, so I'm glad that you addressed that one too. For someone, if they should get monkeypox, what are the symptoms that they should look out for?
So classically, what happens with monkeypox is that people will start feeling bad about a day before they get any skin lesions. And so they'll get a headache and a fever. Their lymph nodes might swell up a little bit. They'll get achy. And so they'll have those kind of nondescript body symptoms for about a day before they start seeing lesions. And then after that, they'll notice usually kind of some flesh-colored bumps. And then those bumps will turn into looking like blisters and maybe like pimples. And eventually they'll go through several stages and then they will crust over and fall off. And once that scab is totally gone and a new layer of skin is there, that's when people aren't infectious anymore. And so the rash has to go through that whole series of progression. And it usually takes about 2 to 3 weeks. And then people will have a fresh layer of skin. All of those lesions will be gone and they won't be infectious anymore.
That was my next question, is what does the course of the infection look like for someone if they become infected?
And so it does depend a little bit on the person themselves and their immune system, how strong it is. But most of what we're seeing right now is that people will get over all of their symptoms in 2 to 3 weeks.
Okay. And if someone maybe should get exposed to it, if they find out that they were potentially in close contact with someone who was a positive monkeypox case, what should they do?
So they should reach out to their healthcare provider who will put them in contact with or contact them themselves, the health department. And so right now, what we've got, which is also different than COVID, is right now we have access to vaccines that can help prevent the development of disease even after somebody's been exposed. And so we've got vaccines that can help for post-exposure prophylaxis, help prevent the development of disease. And even if you get it a little bit later, it can help decrease the severity of that disease. And so by just notifying the physician or the local health department, that can start that whole process of getting that post-exposure prophylaxis or that vaccine into that contact to try to prevent them from getting monkeypox disease.
We did hear about the U.S. Department of Health and Human Services saying that it would kind of speed up a distribution process for that monkeypox vaccine to the areas with the highest spread of the virus right now. Has Texas received any doses from that particular plan?
We have. And so Texas was given an allocation of doses. Now, those doses of vaccine are still being held at the Strategic National Stockpile, but they're for Texas use. And so we've been able to order those vaccine doses very easily. The orders go through our state health department, DSHS, to the CDC and to the Strategic National Stockpile. They have been getting vaccines out across the United States and into Texas within 1 to 2 days, usually around 30 hours. And so it's been a really efficient process, and we've been able to get the vaccines that we need in Texas.
So has Texas been able to administer some of those?
We have,
Okay.
yeah. Local health departments and providers on the ground across the state have been really good about helping us get vaccines into people who were contacts or presumed contacts, just to help prevent some monkeypox disease.
Interesting. Okay. Well, I guess maybe that might beg the question for some people, like, is this readily available where you could get that, or do you need that direct exposure or be a positive case in order to get that shot?
Yeah. So right now, that vaccine is approved for use just in specific circumstances. And so for people who work in the lab and have to deal with these viruses, they can get this vaccine as pre-exposure prophylaxis to try to protect them against getting any infection. And the vaccine is also authorized for use in people who have had an exposure. Either they know that they had a close contact with somebody with known monkeypox, or they were in a setting where monkeypox was being spread and they had close contact with other people. And so there's really specific populations right now that we're trying to get that vaccine into. But we also know in conversations with CDC and with the company who's manufacturing the vaccine that they're really ramping up that vaccine production so that we can use it a little more widely and make sure that the people who are most at risk can get that vaccine.
Of the 20 cases now confirmed here in Texas, what is the case investigation revealed about where these people got it?
Yeah. So it's interesting, and this is going to be an evolving picture, right? And so at first, a lot of our cases were associated with international travel and some domestic travel, but we're seeing more and more cases where there's no reported travel. And so we know that there is some transmission occurring in communities in Texas. And right now, where we're seeing that those cases identified are kind of the bigger metropolitan areas, so the Dallas-Fort Worth area, the Houston area, the Austin area. And in all of those locations, we're seeing what looks like cases that aren't necessarily associated with travel. And so we know that this is going to be an evolving picture. And so not only with just their travel status, but also the people who are being affected. Right now, it's mostly men. But with just that skin-to-skin contact causing or transmitting infection, we know that it's going to be able to spread to all people across the state, around the world. And so it's something that we'll just look forward to kind of seeing this evolving picture around monkeypox and knowing how we can best intervene to protect people.
The CDC sent out in its initial alert about monkeypox that some of the initial cases here in the U.S. were showing up in gay, bisexual, or men who have intimate relationships with other men. However, experts are pointing out, this is a communicable disease that can affect anybody. So I'm wondering if you have any concerns about monkeypox creating a stigma for the LGBTQ community in Texas.
We do, because we know that right now, many of the people who are getting this monkeypox disease are men who have sex with men or identify as gay or bisexual. But we know that these viruses don't really care, that they're just being transmitted through close contact. And that, as I said, the group that's most at risk right now might not be the same one that's at risk in a week or a month. We expect that this is going to be transmitted through different populations and anybody that has close contact with somebody else, including household contacts. And so while we are a bit afraid about the stigmatization, there's not really a place for it, because really we're all susceptible, and that close contact that happens between individuals is enough to spread it.
Yeah, thank you for addressing that, because I've seen some pretty distressing things online about kind of targeting the LGBTQ community for this particular virus.
Right.
Yeah. One other thing that I'd like to ask you about is about testing for this. We heard from the CDC rather, that LabCorp, the national testing company, is going to start offering testing for monkeypox. That's supposed to double the testing capacity for the country. However, I'm wondering, in Texas, are there places where people can go to get tested right now?
Yeah. So we are able to do testing at some of our public health laboratories that we've got spread all across the state. And that's how we've been doing our testing up until now. And so a provider or the health department will get the swab and then send it to our public health labs. But you're right. So LabCorp announced that they're going to start testing. CDC is working with 4 other commercial labs as well to get them onboarded with this monkeypox or orthopox virus assay that they're going to be using. And so we're going to see a steep increase in the number of people who can be tested for this virus, which is fantastic. Right now, we haven't come close to exceeding our capacity for testing for monkeypox. So we're still in a good position for testing the number of people that we need to in Texas at this point in time. But having that extra capacity will allow us just a little bit of wiggle room in case we do start to see some bigger outbreaks in Texas, that will have all of the lab capacity that we need to get people tested.
All right. Well, what is the Department of State Health Services doing to kind of spread the message about monkeypox and raise awareness about it, even though cases are still very low here?
Yeah. So we are trying to work through some of our media and on our website. So if you visit our website at dshs.texas.gov, you can see an update about the case counts that are happening in Texas, as well as a lot of information about monkeypox itself. But we're also working through partner organizations to help get the message out, because we know it's going to need a team effort to really get to all of the healthcare providers that need to know about monkeypox, and all of the people in the community that need to know about monkeypox. And so we'll be working with community organizations and medical organizations across Texas to make sure that people know what they need to know to protect themselves and the people around them.
Just to circle back with everybody, if you're just joining our live stream, we have Dr. Jennifer Schufert here. She is the state chief epidemiologist for the Texas Department of State Health Services, and she's been kind enough to answer some questions today about what monkeypox is and some other related things, because we have now some confirmed cases across the state. But Dr. Schufert, I want to also circle back to a question we had earlier. Some people on our Facebook live stream right now, we're asking about what the symptoms are and how this is spread. If you don't mind revisiting that and sharing that information again.
So the symptoms start off that first day that people get symptoms. A lot of times they just kind of feel bad. They get a headache, they feel achy, they develop a fever, and some of them will get lymph node swelling. And usually about a day later, they'll start to get some skin lesions or a skin rash. And first, it just starts off kind of as skin-colored bumps, and so they aren't really worrisome to look at sometimes right at first, and then they'll develop and they'll progress over time, and they kind of start then looking like blisters, and then a little more like pimples, and eventually the top will come off and they'll kind of scab, and then once that scab comes all the way off and that skin is healed, that's when people aren't infectious anymore. And that whole progression of starting with those symptoms of just feeling achy and yucky, and then going all the way until those scabs fall off, usually takes about 2 to 3 weeks. After somebody has contact with somebody with monkeypox, that incubation period before they start having symptoms is oftentimes between about 5 days and 2 weeks. It can go all the way to 21 days. And so you do have this incubation period right at first before you start developing symptoms. And then at that point, it's usually about 2 to 3 weeks before all of those symptoms are gone and the person isn't infectious anymore.
And remind us again how this is spread at the moment, because
Sure.
some people may confuse it with COVID.
Right. So with monkeypox, what we're seeing with the current outbreak, now I have to say, monkeypox is something that we've known about for decades in Africa, and a lot of times there, it's a person that has contact with a wild animal or a rodent. And so that's kind of classically how we thought about monkeypox. But what we're seeing with this current outbreak is that most of the spread is happening in people who have really close skin-to-skin contact. And so that's where we're seeing lesions, is where their skin has contacted somebody else's skin that has those lesions. Now, there is a chance that people can spread it through respiratory droplets, like little bits of respiratory secretions that come out when you sneeze or cough or talk. And so sometimes we will see that spread if people are really close together and are close enough that they're exposed to somebody's respiratory secretions. But in this current outbreak, what we're seeing most of all is that skin-to-skin contact that's really spreading this disease.
Are there any safeguards that we should keep in mind to avoid an infection? Mind you, again, everybody, that the case count is very low here in Texas at the moment.
Yeah, so I guess going back to what you were saying, like, this is very different than COVID, right? We're not seeing it just spread through the air to random people walking by. It's not having that same sort of transmissibility that we see with COVID. And what we know with monkeypox, or at least what we've seen so far, is that people are spreading it once they're symptomatic. So, you know, with COVID, sometimes people were spreading it, for a lot of times, people were spreading it before they even had any symptoms. They didn't know that they needed to protect other people because they didn't have symptoms of the disease. But with monkeypox, what we're seeing is that people are spreading it once they have symptoms. That's when it appears to be infectious. And so people should be aware of their own bodies, and if they are developing skin bumps or those other symptoms like fever and lymph node swelling and headaches. So if you're having those symptoms, just reach out to your healthcare provider and let them know, and they can help navigate, like, is this something that could be monkeypox, or is this, you know, some other disease that could be circulating right now? And then if you are in close contact with somebody, you know, it's best to have clothing if you don't want to spread something that spreads skin-to-skin contact, or if you notice that somebody does have a skin rash or skin lesions, it's best not to have close skin-to-skin contact with that person. And so just kind of being aware of what's going on in your own body, and then if you're in close contact with somebody, if they have any skin lesions, and in all cases, your healthcare provider can help you kind of look at that rash and figure out what next steps might be.
Dr. Jennifer Schufert, we appreciate you joining us. And before I let you go, I just want to ask you if there's a place where people can go to see information, if you don't mind sharing that, for anybody that has any more in-depth questions about monkeypox and concerns.
Sure. So if you go to our website, we're at dshs.texas.gov. And up at the top of the banner, there's something that says news, and you can go to our news page, and on news updates, it'll give our case counts as they stand and a little bit of epidemiology about those cases. It'll also have links to other monkeypox information. So that's just Texas-specific information. If you want to know what's going on nationwide or worldwide, the CDC also has a Monkeypox 2022 webpage that has more information about kind of what's going on nationwide and globally. So those are fantastic sources of information, and hopefully that'll answer any lingering questions that you've got.
Dr. Jennifer Schufert is the Chief State Epidemiologist from the Texas Department of State Health Services, and she's been kind enough to give us time today to answer some of our questions. Dr. Schufert, thank you again. We really do appreciate it, and hopefully we'll have you back on sometime if we should need the situation arise to answer some more questions.
Sounds good. Thank you so much.
All right, we really do appreciate it. Everybody, if you'd like more information about our reporting on monkeypox and the situation here in Texas, you can find it at kxan.com. Also on the KXAN News mobile app. You can download that onto your smartphone if you haven't done so already. Once again, I'm Will DuPree here in the KXAN Live studio. Thank you all for watching this afternoon. We will see you back here at another time with other updates. Please take care, everybody. Stay safe and enjoy the rest of your Wednesday.